Our organization represents families and young people across the state who are navigating behavioral health systems every day. And what we hear from them is both simple and urgent, and probably repetitive from what you've heard all day long. When families reach out for help, they need a system that responds, not one that makes them wait. New York is in the midst of a mental health crisis, and these are not isolated stories. Across communities, parents are doing everything they can to support their children, yet many are met with months-long wait lists, limited provider availability, and services that are increasingly difficult to access. Too often, care only becomes available once a young person has already reached a point of crisis. Providers want to meet this need, but they are struggling to keep programs staffed and open. Workforce shortages, rising costs, and administrative burdens are pushing many providers past what is sustainable. This is why a meaningful targeted inflation increase of 2.7% as the bare minimum is critical to stabilizing the human services workforce, so providers can retain staff, maintain capacity, and ensure families can access the care they need when they need it, not months later. We also urge the legislature to protect and expand family and youth peer support services. Peer advocates bring lived experience that cannot be replicated in traditional clinical settings. They help families navigate complex systems, reduce isolation, build trust, and often prevent the need for higher levels of care. These services are not only effective, they are cost-efficient and preventative. Yet despite growing demand, peer programs remain underfunded and vulnerable to staffing shortages. At the same time, systemic barriers continue to delay care for children and families. Families are spending critical time searching for in-network providers while programs manage payment delays, administrative requirements that divert attention away from service delivery. Behavioral health services must be carved out of Medicaid managed care so that public dollars are directed towards timely, appropriate care rather than processes that continue to restrict access. Finally, New York must expand investment in community-based youth mental health services. When families can access support early and within their communities, we reduce reliance on emergency rooms, hospitalizations, and more restrictive interventions. Early access leads to better outcomes for young people and strengthens families' ability to support their children at home. Families and young people across New York are not asking for extraordinary solutions. Rather, they are asking for a system that works when they reach out for help. Again, not months later. Thank you for your time, your leadership, and your continued commitment to the well-being of New York's children, youth, and families.